I frequently see patients seeking chin augmentation to improve their facial profile and balance. They'll say things about having a weak chin or being frustrated with their profile. Chin projection issues fall into two main categories. Some people have weak chin projection since they're teens due to their genetics and natural bone structure. Others notice their chin losing prominence over time as part of the aging process. What surprises many patients is learning that age-related changes in the chin are primarily due to bone loss and not just a loss of fat. In fact, the characteristics of facial aging we're all familiar with is significantly due to bone loss resulting in less projection and support affecting the cheekbones, jaw angles, and your chin. Additionally, this bone loss is accompanied by changes in soft tissue, muscle, and fat, creating a compound effect that diminishes chin projection and overall facial definition. Having been in practice for over 30 years, I can attest to the benefits of placing silicone chin implants, which have been the gold standard for chin augmentation for decades. A chin implant provides long-term results and compared to other facial implants, tends to maintain their fit well over time. However, the design of chin implants results in some increase in the width of the chin area, which for many women is not a desirable result. Another obstacle for people who may be good candidates for chin implants is the commitment. For most people, this would be their first facial implant surgery, and they're making a major commitment to a permanent change. If they're not satisfied with the results, revision requires another surgery for implant removal or replacement. This is why I recommend a non-surgical method to get results comparable to chin implant surgery called structural volumizing. Structural volumizing is not conventional filler placement. I use techniques that originate from my surgical implant experience to place long-standing hyaluronic acid fillers like Juvederm Voluma directly at the bone level. Placing filler at the bone level rather than in soft tissue provides several crucial advantages. First, it's more stable and unlikely to migrate. Second, this method creates the same structured, defined appearance and natural feel as the bone itself. Third, the overlying muscle layer helps to shape and keep the filler in position, just like it would with a facial implant. What I find remarkable about this approach is the level of customization that's possible. Unlike a silicone implant that can be modified up to a point, I can address fine details and asymmetrical areas to deliver very small volumes of filler in a way that simply can't be achieved as accurately with the rigid implant. Perhaps the most compelling reason to try filler for chin augmentation first is the reversibility. Hyaluronic acid can be dissolved using an enzyme called hyaluronidase if we want to make adjustments or fully dissolve the filler. This is why I only use hyaluronic acid as a filler for chin augmentation. In contrast, some practitioners offer permanent or semi-permanent fillers made up of materials like calcium hydroxyapatite or PMMA, which comes with some risks. These materials cannot be dissolved like hyaluronic acid. So, if there were to be an infection or foreign body reaction requiring removal, surgery would be the only option, and this can be technically very difficult. I have helped patients dealing with complications from permanent fillers and have removed surgically in ways that had to be effective but limited because some material is beyond surgical access. When you understand this, the temporary nature of hyaluronic acid isn't a limitation, but rather it's a safety feature. When I evaluate patients for chin augmentation, especially those with age-related volume loss, I don't look at the chin in isolation. The chin is part of a continuous jawline, and optimal surgical results means looking at the entire lower face contour. Volume loss along the jawline, particularly in an area called the mandibular notch, can disrupt the smooth transition from jaw to chin and contribute to the undesirable appearance of jowls. By addressing jawline volume loss with filler placed at the bone level alongside chin augmentation, I can create better overall definition and harmony in the lower face. This comprehensive approach often produces more natural and satisfying results than focusing only on chin projection in isolation. The patients I treat with structural volumizing consistently express amazement at both the immediate results and the natural feel. The procedure takes less than 30 minutes with results visible immediately and improving over the following weeks as any minor swelling subsides. Most patients tell me they feel more confident in both profile and frontal views, reporting that their facial features finally feel balanced.